Hi, I'm Dr. Dean, and this is just a short informational video on presbyopia. So although presbyopia may sound like a new, strange word that you've never heard of, it's something that every single person on the planet experiences. It's not abnormal, it's not a disease, although it may feel like a disease. It's something that happens to every person on the planet. It's unavoidable. And so what it is essentially is when you get to around the age of 40, and above, sometimes slightly earlier, sometimes slightly later, depending on a variety of factors, your ability to see near becomes a problem. So your ability to read. So just to understand the basic concept of how your eye focuses helps you to understand what presbyopia is. So in a normal eye, which we would call an emmetropic eye, in the relaxed state, when you look into the distance, your eyes are relaxed. No muscles are contracting, your eyes are in a relaxed state. You can see well in the distance. So from 6 meters to infinity, your vision is good. For driving, for watching television, etc., your eyes in the relaxed state or in the distance. As soon as you want to look near, what happens is your eyes do work. They accommodate. And so there's a muscle called in the ciliary body that contracts. The lens in your eye changes shape and it brings your distance vision, the focus, into near. So that mechanism is your lens. This is the crystalline lens you were born with. And around here, there's a muscle called the ciliary body. And that muscle is attached to the lens by little springs called zonules. And as that muscle contracts, it moves this lens slightly, it changes the shape of the lens, and it brings things into focus. So when you look from far to near, your eye does work. The muscle contracts and brings near objects into focus. Over time, there's a variety of factors that come into play. This lens becomes more stiff, and the mechanism with which you can focus becomes worse and worse. So it isn't able to focus. So initially, you may, when you are young, 10 years old, you may be able to focus at something even a centimeter away from your eye because you're able to change the focus. Over time, the ability to accommodate gets less and less, and so that distance gets further and further away, till at some point, just reading, a book or looking at a text on your phone becomes a challenge because that mechanism isn't working properly anymore, and so we call that presbyopia. And it's, as I said, it affects everyone. So the solution to presbyopia is potentially a whole topic on its own. But the basics, and when a lot of people start, is by getting a pair of reading glasses, right? So, these may be prescription, they may be over-counter. Often, commonly, they're in strengths between +1 and +3. So this is an example of just a simple pair of reading glasses. These are +2 readers. And essentially what they are is they're plus glasses. And the plus basically brings things from focus, from distance to near. So these glasses then do the work of what normally your eye would do when it was accommodating, bring things into focus. So by putting them on and having something, your eye is still in the relaxed state, but it's changed the focus. Instead of your eye lens changing the focus, this brings the focus from far to near. And just to understand the basic concept, because a lot of people say, well, what strength reading glasses do I need? There's a personal preference to that, and listen, there are other components too. If you have astigmatism, if you want to wear multifocals or bifocals, or there's a whole other discussion on glasses correction. But just in general with reading glasses, the stronger the glasses prescription, so at the higher the number, if it's a +1, +2, +3, the closer the focal distance. So if I was emmetropic and I had good distance vision without glasses, and I was 50 years old, I would struggle to read a chart very easily. And so I may need a +2. Now, if I'm wearing a +2 and I'm finding that this is still unclear and I have to take it further away to see it, I need to increase the strength to maybe a 2.5. If I'm finding I'm having to hold things really close to see them with the glasses on, it means the glasses are too strong and I need to reduce it. So if you had to think about it, the focus would be about maybe a +1 would be in focus there, a +2, a +3, a +4, a +5. So the increasing strength brings the focal distance closer to the eye. And so often initially you can go over the counter, find a pair of glasses, have something to read like a newspaper or your phone, etc., and move your phone in and out with a pair of glasses on and see where it is, where the focus is. If you're having to hold it too close, you need to come down with the strength. So if you're at a 2.5, you'd come to a 2. If you're having to push it away, then you're going to have to increase the strength of those glasses to bring the focus near. That's the basics of how reading glasses work. There are other solutions for presbyopia. There's monovision, there's refractive lens exchange, laser refractive correction. There's a few other options, but when everyone starts, normally the thing they reach for first is a pair of reading glasses. Now, the disadvantage to reading glasses is that when you put reading glasses on, you'll be able to read here, and it may be clear, it may be at a comfortable distance. But when you look into the distance, things are blurry because these are now focusing here, they're not focusing there. And so that becomes frustrating. And that's often the frustrating with purely reading glasses, is that every time you look into the distance, you have to move your glasses to see clearly. And then when you want to look at your phone, you need to put on your glasses again. And if you look into the distance, you have to remove them again. So reading glasses, although they do work and they're normally very cost effective and easy to get hold of, from a practical point of view, depending on your lifestyle and needs, they may not suit you. In which case, something like multifocals, and multifocals essential at the top part of the glasses has a script for distance, and as you look down to the bottom, it has the reading glass section, or the reading ad, we call it, at the bottom of the glasses. So that's the basics of presbyopia. I think it's important to understand that that's something that affects everyone to a degree, and that there are a variety of solutions, but those solutions all depend on the patient, their needs, their lifestyle, their job, etc. But yeah, those are the basics of presbyopia. I hope it was helpful. And yeah, if you need more information, please feel free to contact us.